Hello everybody, my name is Theresa Benezeder. I'm from the Medical University of Graz, and for my PhD project I'm investigating the mechanisms of Dithranol in psoriasis. Today I would like to share with you some interesting findings about the chemokine CCL22. We found that CCL22 plasma levels correlate with disease severity and predict response to Dithranol treatment. So in this study, we enrolled 15 psoriasis patients, and as you can see in this graph here, we have 4 different time points of biopsy and blood sampling, which is before treatment at day 0, at day 4, then at the end of treatment, and finally at the follow-up. Now I'd like to quickly jump to the results. And in this graph, you can see that Dithranol treatment reduced the PASI score by a mean of 57% after only 2 weeks of treatment. And this you can see here on this graph, which I have split it into mild and severe patients at baseline. So, however, not all of the patients responded in the same way. And when we looked at chemokine levels in plasma, we found that CCL22 plasma levels are higher in patients with severe psoriasis, which you can see here on this graph. So a correlation analysis then showed that CCL22 plasma levels correlate with the disease severity, correlate with PASI, before, during and after treatment. And in E, you can see that also the pre-treatment values of CCL22 inversely correlated with PASI reduction, with overall PASI reduction. So in other words, higher plasma levels of CCL22 predict a worse response to Dithranol treatment. So another interesting finding that I would like to share with you is this graph here. Here you can see CCL22 and CCR4 gene expression as determined by microarray in skin lesions. And in this graph, you can see that CCL22 and CCR4 are upregulated in lesional versus non-lesional skin. And CCL22 and its receptor are both downregulated after Dithranol treatment. So, to conclude, I would like to say 3 things. At first, patients with severe psoriasis have higher CCL22 plasma levels. Second, these plasma levels significantly correlate with disease severity and may predict response to Dithranol treatment, which means that CCL22 could serve as a potential biomarker. And third, if you want to know more about this poster or our research project, please come visit me at the clinical outcome sections for the posters. Thank you very much for watching.